So, Lubna, I've seen so many videos on Instagram and TikTok where people are coming in with no teeth and leave them with a full smile by lunchtime. They make all-on X look like magic.
Yeah, that is true, Dami. And I think it's so important for us to give the patients the right information because it sounds catchy. And however, technically, immediate loading, it can be done. There's some patients, they can have the immediate loading, but not for everyone. So the key message that we don't want the patients to get lost online. So the first thing is the patient, when they present to us in the clinic, is so important to educate them about that.
Okay, so let's say a patient comes in with hopeless periodontitis and their teeth are mobile and they've got infections and bone loss and all these things, and they've been told by somebody on Instagram that all-on X is a one-day fix. Is that what they should really expect?
Yeah, so first we need to stop and ask, where are we at with this patient? So if we, as you said, periodontitis patient, which these are the usual patients that we have here, Dami. So usually we have to control the infection, which is so important. Number two, do we have enough bone to do such treatment? Number three, their medical history. Why did they lose their teeth from the start? Is that because of neglect? It's so important to educate the patient about oral hygiene, and that long-term maintenance is so important. Do they actually smoke? So all of these have a huge effect on safely placing the implant, safely placing them immediately or not, and also safely loading these implants. Do we need to do them in one stage or two stage?
Okay, so they can't just extract the teeth right then and there and place the implants.
Well, in some cases, yes, we can do that, absolutely. That's a protocol that we can do, but in some cases, no, we can't. We have to first extract the teeth and then wait. And then why do we extract the teeth? Because we want to make sure that this bone is healthy. So sometimes we need to debride the bone, get rid of the infection, and that's what we call socket debridement. And then we wait for 3-6 months, sometimes even longer, to bring these patients back to place the implants. There's something so important is that some patients will need even extra treatment, so extra surgeries, which is bone grafting and sinus lift.
So with that said, what if there's not enough bone?
So if there's not enough bone, so we're talking about doing procedures, what we call ridge augmentation. So that's building up the bone. So when you have really thin bone, we have to have certain measurements because we want to make sure this implant is surrounded with nice, healthy bone around it. Number two, if these patients, for example, they don't have enough height of the bone, sometimes we go in the sinuses and we do something called a sinus lift. So what we call is the bone build-up procedures before having the implants.
Okay, so when you finally get to placing implants, how do you know if the patient is ready for loading or not?
Again, so sometimes we can immediately load on the same day. You saw myself and Shakri, Dr. Shakri, the prosthodontist here. We've done a number of cases. However, we need to check for some things around the implant. For example, primary stability is so important. So are these implants placed in the bone, are they stable in the bone? They're not moving if we immediately load them. Bone density, and this is a very important factor, especially that patients coming to us are patients of periodontitis, so they have reduced bone density. Occlusion is an important factor. Am I doing immediate loading on the lower? Are they the patient's natural teeth? So provisional bridge might be possible to have on the day, which they call teeth on the day, but sometimes we need to do delayed loading, which is about 3 to 6 months, sometimes longer in some patients.
Okay, so once they're done then, are they all set forever, right?
I wish, I wish, Dami. But you know yourself, like we bring our perio patient to maintenance. So what about implants? Like we have to bring them back. So this is what I actually do. So we usually tell the patient, if you brought a Mercedes or a BMW, this is one of the best cars in the world, right? You still need to go to the garage and have the oil checked. You need to have everything maintained. So it's the same thing. Even if we did the best placement of implants, if the patient don't take care of the implants, we're not going to go anywhere. So what I usually do for patients is that before they get their final prosthesis, I bring them in and say, these are your implants. And then you will have something on these implants. Can you actually see them? No. So we need to make sure that they clean them really well and give the proper oral hygiene. And sometimes they come to us, say, every 3, 4 months, 6 months.
So this one-day smile really is months of planning, healing and discipline then?
Absolutely, 100%, as any treatment in dentistry. Everything needs discipline, have to be staged, custom to each patient. So yes, it's life changing. I have a lot of patients, they say, I can eat better, I'm more confident, but if it's done right, because what we're looking at, Dami, is not really a successful treatment short term, but successful treatment long term.
Yeah, so if you're considering All on X, come in for a consultation, a proper one, and we'll guide you through each step. We're here for long-term smiles, not just shortcuts.
Absolutely, no shortcuts in Keystone.
See you soon, guys.
See ya.